Hi. Hello there. I hope you can hear me okay. We're using a new tool today. Happy Easter. It's still Easter for those of us who are celebrating Easter Monday, I suppose. Welcome to the MS Path. My name is Terry Jacqueline. I'm a naturopathic doctor, and I've been certified in functional medicine too, to bring a new flavor to that. Today, we are delivering on Gail's request to talk about dental health, and I am incredibly excited because I have probably the wisest man on that subject on the planet, Dr. Dickson Thom, with us today. Very excited about that. Next week, we are also going to deliver on a very frustrated Wahid's request for what are foods that he can eat, because of course we talk enough about what we can't eat. So that's what we'll be doing next week. Before we get to Dr. Thom, I just wanted to say last week I promised that I put together a 5-day challenge for you, and I'm just polishing it up now. It's called 5 Days to Spark Up Your Life with MS. It's a great boost for this time of year, whether you're getting back on track, whether you just need a bit of a refresh, or whether you've never been on track and you're looking to get on track. This is a great program for you, a mini program. It's just $25, and once you download it, it's yours, and you should probably do that once a month or at least once a quarter. And Mike is going to put the link to that. You can register for it today, and it'll be delivered to you on Saturday. It's just $25. And
the tagline is "Get with the program."
Yeah, get with the program. Okay. Now, I'm very excited to welcome Dr. Dickson Thom. And there we go. You can see him. Dr. Thom has been a clinician for over 40 years. He was a medical professor for 20 years. He was the Dean of Education at the Naturopathic College in Oregon. He writes, he's an award winner for his contribution to medicine and the community and tying all of that together. Let's see, what else? Did I say you've written books and papers? And most recently, he's the founder of the American Center for Biological Medicine in Scottsdale, Arizona. I have learned more from this gentleman in the last 20 years. Can you believe I've known you for 20 years, Dr. Thom? Yeah. Than I have in 3 university degrees. That's how smart this gentleman is. And before all of this, he was a dentist. And Dr. Thom, I want to segue into our conversation by sort of remembering something you told me quite a while ago, that you got in trouble quite a bit when you were a dentist, because when you looked into the mouths of your patients, you saw more than teeth. And I'm going to leave that wide open for you and pass it over to you. What was it that you were seeing in the mouths of these people that was getting you in trouble for doing stuff you shouldn't have been doing as a dentist?
Thanks, Terry. Thanks for the very kind introduction. So one of the things, that has happened in dentistry that happened a long time ago is, for some reason in medicine, dentistry is the only almost separate specialty that there is. Every other body part is sort of tied into the medical system. That being said, however, we know that the oral cavity is the window to the rest of the world, being every other organ that we have. And so when you would look in someone's mouth, as soon as we could see that they've had a filling or they have a cavity, and knowing that what causes the need for a filling and what causes cavities would say, if it causes a problem in your teeth, the hardest tissue, one of the hardest tissues in your body, what is it doing to your soft tissues? What is it doing to your heart? What is it doing to your digestive system? What is it doing to your big toe, in fact? And so we can use, there's over 400 different conditions that have been reported in the mouth itself, but they don't occur independent of happening anywhere else in the body. So when we look in someone's mouth and we say that they've had a lot of dental work, it tells us about lifestyle, for one thing, and the same lifestyle that caused dental disease is the same lifestyle which will cause potentially any other type of chronic disease that a person has. So when we start off with children who had a number of cavities, it became pretty evident that whatever this child is eating, and it's not just about oral hygiene, it truly diet plays a huge role. And so the diet that affects your teeth will affect every other organ. So I got to a point where it became very evident that the standard aspect of looking at dentistry and just doing fillings or root canals or extractions or partial dentures or whatever was really just such a small part of the big picture. And then I started talking to people that said, well, the migraine headaches that you're talking about, maybe related to the food that's causing the same thing and you're necessitating that. Have you ever looked at diet specifically in regards to your migraines? So when I started to get into those issues, they were a problem.
Yeah. Well, that's interesting too, because Dr. Weston Price, of course, correlated the shift in diet historically about 20,000 years ago to more dental cavities and shorter stature and that kind of thing. And that was the time in history when we started to eat more wheat and eat more dairy products. We stopped wandering around and foraging for our food and decided that in community we could do things better. But that's interesting that continues. Yeah. So yeah, definitely. I never thought of the whole hard tissue versus soft tissue thing. That's a really interesting perspective about that. Now, so going from the fact that you have cavities to what we fill them with, I know a lot of people out there have probably got questions about mercury amalgams and specifically with MS, because our listeners today have got a lot of them have MS.
So one of the oldest filling materials, believe it or not, have been used for literally several thousand years. About 150, 160 years ago, J.B. Black was one of the first dentists who figured out that you could take some 4 or 5 metals, take mercury, stick them together, and would make this sort of putty type material that you could then stick in somebody's tooth, once you remove the cavity, and it would basically replace some of that broken down tooth structure. And so the aspect of the fact that it's been around for so long is so-called, that's why it's okay, because it's been here for so long. Well, of course, it's not safe. Unfortunately, there's only one safe place that you can put mercury nowadays, and unfortunately, it's in people's teeth. You can't put it in the garbage. You can't ship it across state lines. You can't.
Can't put it in vaccinations.
Can't put it in anything, but you can still put it in somebody's teeth. We know mercury is one of the most highly toxic substances there are. The dental profession has always felt, well, it stays within the confine and why do we have mercury? Because mercury is the glue that holds these metals together. That's why they use mercury, and it serves that purpose. Unfortunately, however, the sense of chewing and grinding our teeth eventually will vaporize this mercury, and if you're lucky enough, you'll breathe it out. If you're not lucky enough, it'll somehow get into your system. And because mercury is a heavy metal, it's very difficult for the body to be able to remove it, and starts to build up. Somebody with multiple sclerosis, specifically, it's been well shown that it has a mercury, not only with MS, but anybody, has a very toxic effect on the nervous system. So it's quite a detrimental metal to have anywhere in your near vicinity if you want it, especially when you have any type of nervous system disorder or problem.
Now, I know I had a number of mercury amalgams when I was first diagnosed. It was about 33 years ago now, but I had them removed because of information that I had read at the time. And my prognosis on diagnosis was that I would be very quick to severe disability because of the number of lesions on my brain. Now, I often wonder if having my mercury amalgams had removed had anything to do with it. But would you recommend that people get their amalgams removed, Dr. Thom?
The individual question, and that's always a question that when I'm asked, I sort of take an interesting dental history of say. So what happens with over time with the mercury amalgam filling is eventually the filling starts to wear down. So you go to the dentist and the dentist says, oh, this filling is leaking, or we have recurrent decay around the filling, et cetera. We need to replace the filling. So there's, depending on which dentist you talk to, and for just for sake of over averaging, I say if you've had a mercury filling for more than 17 years, I don't think you need to rush out and get it removed. The reason is because the mercury that's going to escape has already escaped. So mercury's fillings start off more or less 48 to 51% mercury. As the mercury escapes, since it's the glue, the filling will either break, crack, or leak. And then it says, oh, you need to have this filling replaced. Now, if it's been there for 17 plus years and it's still working, then if you take it out, you're going to be exposed to a whole ton of mercury. It's not going to leak very much after that period of time because it's going to break down anyway. So what it means is you never would replace it with a new mercury filling, but I don't automatically. But if somebody said, oh, I just had mercury fillings done 3 years ago, I said, those we should work on a detox program to allow you to be able to remove them, because over the next 15 years, you're going to continually be exposed to more and more of the mercury that can escape from these fillings. That's what we want to try and stay away from.
Okay. Now, Sherry here is asking a question that I think I know what you're going to say on it, but I'm going to ask it anyway. Does removing those fillings alleviate MS symptoms?
I wish I could say absolutely, but no, because it's not the mercury in your fillings that's causing that. It's the mercury that's in your nervous system. So just the filling out reduces the exposure to mercury, but now you still are going to have to work with a naturopath like yourself to basically get it out of your body so that it's not only is it not in your teeth, but it's not in your nervous system. So it's not just, oh, take it out of your fillings and it suddenly leaves the nervous system.
Yeah. And I guess on top of that, it's also how sensitive your nervous system is. I guess individually people react differently. So, okay. Very good.
That needs to be taken into account when you see a dentist who knows how to safely remove these fillings. And you definitely need to go to a dentist who has been trained in the proper removal of a mercury filling. It's not just go and have it, drilled out, and because you get so much mercury exposure, it's rubber dams and high volume suction and all the other go along with that.
Yeah, exactly. And I think that's really important nowadays, especially because, all things alternative and natural are sort of, very popular. So people are looking for biological dentists. And I don't know about you down there, but up here, I find there are people that are calling themselves biological dentists that really aren't. Then they're not using the proper stuff. So I just wanted to review that quickly. You said rubber dam, high volume suction.
Right. And a mask. In fact, the dentists themselves should be wearing protection because they're getting exposed at the same time that the patient is. So generally, the person should be doing antioxidants. They should be doing fiber. We use a variety of different nutrients and minerals to try and minimize any potential exposure. Be doing mercury removal if constipation is an issue, because the colon is one of the ways that any mercury is being removed. So all those things should be in place first, making sure that we can detox properly. Exactly. There's sort of a whole checklist. And, one of the best questions to ask is just call the office and say, do you have any mercury in your office? And if the answer is yes, then they're probably not a mercury-free dentist.
Yep, exactly. Sherry is commenting back to us, and she said she had all of hers removed and her symptoms got worse. And I would suggest to Sherry and that's sort of overloaded the central nervous system with mercury then. So we need to be doing a detox there for sure. Right?
It's not about the removal that made it worse. It's the fact that the mercury was mobilized during the removal, and based on what we just talked about, if the dentist wasn't careful, and your exposure comes the most when you actually remove them. And so if you're not doing detox before and during that whole procedure, it's not uncommon, unfortunately, that your symptoms can get worse.
Yeah, exactly. Well, people don't realize that the mucous membranes of the mouth, I mean, both of us using biotherapeutic drainage as primary treatment modalities, knowing that that's, a delivery system to the rest of your body, right? So we use it to deliver medicines, but everything else is delivered to the body. Absolutely. Now, those mucous membranes are also an extension of our internal microbiome, and the avalanche of research that has happened in the last 10 years, and specifically in the last 5 years, has really just validated a whole lot of thinking that's been going on around the gut for historically. But the mouth is also an extension of that microbiome that goes down through our digestive system and right out the other end.
Right.
Is that correct?
So yes, that's absolutely correct.
Mm-hmm.
One of the interesting things about the microbiome is unique to each of us. And the microbiome is, in all intents and purposes, your first line of defense from taking anything orally, whether it's through drink or food or whatever. And in fact, it's so protective that, with our partners, so when you kiss somebody, usually if it's not your partner that you've been with for some time, within 15 minutes, your microbiome will kill all the flora, their microbiome, because they know it's not part of you. So microbiome is a huge part of your immune system. And then once we're with a partner for a length, we end up sharing it back and forth. So we have very similar. But this microbiome is formed starting literally with the first feeding, whether it's breastfed, hopefully breastfed, and all the things that a baby gets exposed to. That starts in your mouth, and then it goes through your entire digestive system.
Exactly. Now, that microbiome, so where I'm trying to go with this is inflammation that you can see, like systemic inflammation that manifests in the mouth. So periodontitis and things like that. I know when I see that in especially my MS patients, I think, oh boy, I'm dying to see what their CRP is, because that is, for me as a rookie, that's a marker for inflammation if they've got a lot of gum disease.
Just as I said earlier when we started, the whole idea of having inflammation in the mouth is, if it's in the mouth, it's also in your sinuses, it's in your digestive tract, it's in your heart, it's in your bowel, it's in your gallbladder, it's in all those organs, because it's the same flora that's here that ultimately gets passed on through. So you're right. You can look at inflammation in the mouth and people say, what is when a gastroenterologist looks inside your colon, does a colonoscopy, what does it look like? I say, just open your mouth, pull your cheek back, look at the cheek. That's exactly what it looks like. There you go.
Why do we have to have colonoscopies?
That's what it looks like in there. So I was like, that's the whole idea. So what's necessary for the oral cavity is the same thing that's in your digestive tract. Obviously, there's 400 or 500 or 700 different species throughout our intestinal tract. But our unique, there's a uniqueness associated with our oral microbiome that is responsible for trying to keep our oral cavity, the mucous membranes, the gum tissue, in a healthy state. Plus, our saliva plays a huge role in keeping it in a healthy state.
Yeah, exactly. So, what about latent infections, and what about infections in the mouth, like the things that the decay that causes the need for fillings or root canals or stuff like that, or even infections that get trapped under a root canal that's been poorly done. Actually, root canals, that's a good topic.
So root canals are typically done in a tooth that has been traumatized and becomes infected, most commonly from a cavity that basically erodes away the hard tissue of the tooth. So deep inside the tooth is a mucous membrane. And if I find my tooth model here somewhere, I don't know where my tooth model went.
Forever the teacher, eh?
It's supposed to be here. Somebody stole my tooth model. Anyway, the deep inside the tooth is a nerve canal, and when you have a cavity that goes down and exposes it, basically the tooth becomes infected. And what is unique about a tooth that no other tissue has is it only has one blood supply, and it's through the apex of the tooth. So we have a tooth here. So it's from the bone, but there's no other tissue in the body that has one blood supply. Everybody has, the heart has multiple blood supplies in every organ. So one gets blocked, there's another corollary. If this one becomes infected, there's no additional route, there's no additional way to get blood in. If you can't get blood in the tooth becomes non-vital. And what the dentist does, they go and they make a hole in the top, they clean it all out, and then they replace it with an inert material. Now, the controversy is, can you possibly clear out all the infection?
Right.
Depending on who's doing it, and with the use of lasers and timing and microscopes, we can get a pretty good job. The thing to remember is that, if we had a tooth in here, the bone itself has a great blood supply. What doesn't have the blood supply is what's going on inside the tooth, generally. So if you have a healthy blood supply and perhaps are not on immunosuppressants, for on chemotherapy or some other way that decreases your blood supply. Excuse me.
Well, and that's an interesting point, because a lot of the disease-modifying agents used in MS are still obliterants of the immune system, right?
Right, and that's definitely a problem, and it makes it more problematic because you have the potential that if there is any latent infection, we'll say, in this specific area, your immune system may not be sufficient enough to take care of it. In an otherwise so-called healthy person who may not be on those types of medication, your immune system, technically, the same way you deal with a cold or a flu, should be able to deal with it and take care of it. Right. So it's a very much an individual component to try and deal with that.
Like everything we do, right?
Like everything we do. Absolutely true. Yes.
Tell me about what you see in plaques. And specifically, I've done some reading recently about plaques simply being a manifestation of a biofilm.
Correct. So plaque, for all intents and purposes, is just bacteria. The part of the oral flora that basically form around the edge, around between the teeth, on the teeth, under the gum, etc. And one of the interesting things about plaque, and it's, for all intents and purposes, it's the reason we get dental decay. So this is bacteria. Right. Tens of millions of bacteria that are in sufficient numbers to form an actual substance that you can see. So what happens is that when we eat a fermentable carbohydrate, because that's what they like to mostly eat, the bacteria in this plaque take some of this fermentable carbohydrate, aka sugar or juice or something, fructose, even fruit for that matter, and basically metabolize it. And in the aspect of metabolizing it, it forms acid. And the acid is then what dissolves the hard tissue of the tooth. And if you have so-called acid attacks over a period of time, you will end up with a cavity. And once a cavity starts, the tooth, the top part of the tooth, the enamel, doesn't have the cells to be able to repair itself. Although, just as some of you may have seen, we now are doing stem cells to be able to repair the tooth itself. And that's what's coming. Within probably 15 or 20 years, the filling will go away. We're going to use stem cells. The tooth will basically regenerate itself. So if you disorganize this plaque every 24 hours perfectly, you'll never get a cavity no matter what happens, because it takes about 24 hours for it to build up enough bacteria in the plaque to create what we call an acid attack, to lower the pH below 5.5. The pH goes below 5.5, it's enough to dissolve the tooth. If it stays above 5.5, and your mouth is probably about 7.1 in general, more or less a neutral aspect. So that's what so that's why oral hygiene, the dental flossing, oral, brushing your teeth, etc., is an important aspect. It has to be done minimally every 24 hours, preferably more often than that.
Yeah. Okay. But plaque isn't necessarily then something deeper, right? Like, I'm just thinking of those people who tend to build up plaque very quickly.
That has to do with their saliva. It's the composition of their saliva. Then you look at their minerals that are in their saliva. So, because we know there's a lot of minerals, and in fact, saliva is, that's why we can use tissue salts, change the mineral status of the saliva. And yes, there are some people who will build it up. That goes back to the flora of what happened when starting at birth. Were they given antibiotics? Were they given vaccines? Were they ill often? Are they on immune suppressant medications? It changes the flora, and you get into all those types of situations. And some people are more plaque formers, which means they have to be even more diligent with their oral hygiene. So if they're plaque formers, that means the microbiome within their digestive tract also needs more support.
Exactly.
Which is why we recommend probiotics to be done on a regular basis.
Exactly. Okay, perfect. I want to talk about tonsil stones. So for everybody who's listening and is saying, what the heck are tonsil stones? I'm talking about sort of the white sort of little lumps of exudate that people can literally express, out of their tonsils in their throat.
Tonsil stones, which I've looked at under the microscope, are no different than looking at plaque under the microscope. They're literally full of bacteria, just teeming full of bacteria, just like your plaque, if left in the teeth, will calcify. And so these are bacteria in a nodule, we'll say, that becomes calcified because of the minerals that are in your saliva. And so they are a source potentially of chronic infection. Some people will form them more often, and it's true, they're truly like a little stone, but they're basically calcium salts for the most part, because it's calcium is in our saliva, and they're full of bacteria. It's exactly the same as calculus, which is the hard stuff that forms in the teeth.
Well, and that's so interesting that it's caught in the lymphatic tissue of the tonsil.
Because it's trying to catch and kill the bacteria, but you can't overcome it. And there's
just collecting it.
The little crypt or something, it sort of gets hidden in behind there, and the immune system isn't enough to take care of it, and just swallowing and that isn't enough to dislodge it. The body does not like them, that's for sure.
Wow. So another sign that the microbiome in the gut needs some help, eh?
That is correct. Absolutely true.
Okay. One last thing, and if anybody has any other questions, please, I know I'm going to get a million questions later this week as this video circulates, and I might just have to call you back. But can you speak to our listeners about halitosis, or bad breath, and how that is more than just eating your mother-in-law's garlic pie?
So halitosis has, the first aspect of it's usually, I'll call it dead and decaying matter. And for the most part, it's this microbiome, it's the flora, it becomes out of balance. When it's directly related to the oral cavity, it's usually almost always in somebody who has pretty significant periodontal disease. In fact, far beyond gingivitis, they may be in fact, or a pretty significant decay, or a tooth that is broken and is basically harboring a lot of bacteria. So the bad breath is coming from the fermentation process from these flora. Now, some people will have halitosis. You look in their mouth, they have no periodontal disease, they have no cavities, which means it's not coming from their oral cavity, it's coming from their digestive tract, and it's actually silent reflux that's coming up from a fermentation happening within their stomach or their colon, upper and small intestine, and they're basically having this reflux that comes up, and of course it's passing by the lung, which is breathing out air. So as it comes out, that's what you breathe out, and you have this unpleasant odor that's associated with breathing, that breath. So GI or oral, and or even sinus. You can have chronic postnasal drip for people that don't even know that they have a chronic sinus infection. And you look in their throat and it's a little red and irritated. They think, yeah, I have a little bit of phlegm. That also certainly can commonly cause that type of problem with halitosis.
Okay, that infection, the odor from the infection itself.
Right.
Eh?
It's nearly always associated with the improper bacteria and a fermentation process. That is correct.
Okay. Okay. Well, I think we've covered some great topics. Do you have any words of wisdom that you want to leave us with today, Dr. Thom?
Think of the mouth as this window to the rest of the world, which is what I started with. So if you open your own mouth, look in the mirror, or if you sat many hours in a dental chair, you're thinking, okay, the reason I had to sit in that dental chair wasn't because, the dentist liked to see me on a regular basis, but what I was doing to myself from a lifestyle perspective is definitely having a systemic effect on all my other organs. So take it as the early warning sign. And if you have grandchildren or children who are having to have cavities, take that as a sign that we're already starting potentially to see some underlying problems. And it may be many, many years later before they even tell you that they have a problem. The mouth is a very important component that helps us understand as doctors that there's other things that are going on in the body. And it's very easy to examine by just opening a person's mouth and looking.
Exactly, yeah. I mean, people can do it themselves.
Absolutely. Absolutely. Yes.
Yeah. Okay. Well, I'm very grateful for you joining us today. And I wish you lots of fun down there in that south.
Indeed.
Beautiful sunshine.
Beautiful sunshine. I don't know if you can tell it's coming in my window, but it's pretty nice here today. Yeah.
Yeah, well, after the frost melted off my car this morning, it was pretty nice here too.
We only have about 35 Celsius today.
Oh, I'm sorry to hear that. We've got about 5. I think we topped out at 5 Celsius today.
We have about 35 today.
Okay.
Yeah.
Well, thank you again, Dr. Thom.
My pleasure to be with you to spend a few minutes. Hopefully it was helpful to your listeners. And said if there's more questions that come, we're always willing to try and answer them as best we can.
Perfect. I'll let you know if I'm stuck on any of them.
Will do. All right.
Okay. Take care.
Thank you. Bye-bye.
Okay, bye-bye. Now, I'm not hanging up on all of you guys yet. So, Dr. Thom, I think you can just hit the end. Okay, so there you go. A very good confirmation from a great authority in the field that our mouths are definitely the window to the rest of the world, of our internal world and what's going on in our internal world. So thanks for joining me again today. We'll be back on next week, regular time at 4:30 on Monday. And we'll be talking about some things that you can eat. Once again, Wahid, who I don't see on the call today, but hopefully he'll see this and join us. And I'll try to make it fun for you with some recipes and things as well. I remember that the 5 days to spark up your life with MS is available now. Did you put the link?
I will have that shortly.
So Mike is going to put the link for you to register for that today. And if you register anytime this week, it will be delivered on Saturday morning to you. Okay. Thank you very much. And we'll see you next week.